In this video, we're going to go over the ulnar collateral ligament, also known as the Tommy John ligament of the elbow. This ligament is on the inside of the elbow right here. It's very common to be irritated or torn with athletes that perform overhead movements such as overhand throwing a baseball, javelin, etc. Those can cause repeated trauma to the UCL ligament and thus result in a complete tear. Those tears or sprains are graded 1 through 3. So a grade 1, just mild irritation, a little micro trauma, typically heals and does very well. Grade 2, a little more severe. It's not completely into, but it is more severe than grade 1. It's a little longer with the recovery, and you have to be a little more careful not to cause a complete grade 3 tear. And then a grade 3 is going to be completely torn, and you're going to have some instability with that. So let's go over how that you can test for that. Now we're going to go over the UCL test. And so what we're going to do is create a valgus force. So if this is a right arm, my arm is out like this facing the camera. So a valgus force will be kind of coming in this fashion. So if my arm were out in front of me, that looks like this. So basically this is pushed in at the elbow, lateral to medial. And I'm checking for instability. So I always measure my patient in sitting and I create that valgus force there to see if I feel instability. And then I'm going to put them face down. I have another video on my channel on the elbow section where they're face down, and then I create that valgus force there. That takes the shoulder complex out a little bit, and I feel like gives me a more accurate assessment of the elbow. Now we have to go over what do we do about it if it is sprained. So we're going to say for the purpose of this video, this is a grade 1 or a grade 2 sprain. Now, how would you treat things as far as a grade 1 versus a grade 2? Well, the grade 1, I'm going to progress each phase over the course of about 10 to 14 days, whereas a grade 2, I probably would add an additional week, maybe a week and a half to that. It just depends, maybe even 2 weeks to that if I need to, just depending on how the person is reporting pain and the severity, how weak that it feels, how likely it feels like it's going to dislocate or sublux or come out of place. And with that, that's kind of how I would judge going from, when I progress from phase 1 into phase 2. So this is going to be phases 1 and 2. Now phase 3 is going to be more return to your sport, going through your skills a little bit more. And grade 4 is going to be complete return to sport, high impact, high velocity. That's where we're going to have our throwers program. Our return to throwing program is going to be in phase 4. And so we'll go through all of phase 1 and phase 2 for this video. In phase 1, we're going to focus on range of motion, both at the elbow and the wrist, as well as isometric strengthening. So what we're going to do here is I have a bolster here, so you can use a towel if you have one at home. So I'm going to put my wrist here. I'm going to pull my wrist back, and then I'm going to go down, back and down. Just working on wrist extension, and then I'm going to go into wrist flexion. Now you don't have to prop up your forearm, but depending on how much pain you're having at the elbow, it does take a little bit of pressure and stress off. So I'm just going to go into flexion here, just kind of coming up. And then I'm going to work on radial deviation and ulnar deviation. So basically it looks like this. So ulnar deviation and then radial deviation. So I'm going back and forth. Then I'm going to work on supination, pronation, supination, pronation. And so supination is when the palm is up, and pronation is when the palm is down. That kind of works this forearm through here. Then we're going to work on elbow flexion and extension. So just nice and easy elbow flexion and extension. And you would go as far into flexion or extension as your pain allows. If it's too painful, if you feel like that's clicking or snapping or popping when you do that, just don't go as far. And you're going to do that, and you would repeat each one of these somewhere between 20 to 30 repetitions, for a few sets several times a day. And so now we're going to go into isometrics. So what we're going to do is prop our forearm up here, palm down, and I'm going to take my other hand, put it on the back of my hand. I'm trying to pull my wrist and hand back in this position, but I'm not letting it go because I'm pushing against it. That's called an isometric. So I'm just going to push back. I'd start with maybe 25% of force. I'm not pushing very hard. You should feel this on the back of the forearm here and that extensor mass kind of kick in. And I'm going to hold that. I hold that maybe 3 to 5 seconds and then relax. And I bring it back up and I hold that 3 to 5 seconds and relax. And I repeat that for 2 to 3 sets of 10 to 12 repetitions. Then I'm going to go palm up. So I'm focusing on trying to bring my wrist up like this. So I'm going to take my hand again, put it my palm across my fingers, pull back a little bit and relax, pull back and relax. I'm trying to do this movement and I'm pushing down with my other hand, not letting my right hand or wrist move. And then relax. And you're going to feel this on that flexor mass here on the inside of your forearm. That can be a little touchy because of that UCL ligament being in here, really close to that. So just be cautious of that. Don't overstrain that, just a little bit there, and then relax. And then you're going to work on bicep isometric. So I'm trying to pull my arm up. I'm pushing down with my left hand. So I'm not letting my elbow flex. I'm just pushing down. Where do you start that? Like what part do you put your elbow at? It doesn't really matter. You can start at the bottom. You can start at the top. Doesn't matter to me. You just kind of push there, hold it, a few seconds, and then relax. And the same thing with tricep extension. So we're working on going down. So I've got my hand here. I'm trying to straighten out my elbow, and I'm resisting against it. And then relax, and I'm pushing down, and then relax. I'm going to hold that again for a few seconds, completing 10 to 12 reps for a couple of sets a few times a day. So still in phase one, you know that I'm a big fan of soft tissue work, so we're going to take one of these scraping tools. You don't have to use one of these. In fact, initially you probably should just use your fingers or your hand because this area is going to be sensitive. And so what I like to do is just come in here and just very gently, you can go over the ligament area. Now I have to caution you here because the ulnar nerve is sitting right here, and so you don't want to irritate that nerve because there's a high probability that it's already a little irritated anyway because of that ligament issue. So maybe I go down and I work down on my forearm and I come all the way down the forearm, even away from the elbow down the forearm. I go up in the bicep, I might would come up on my upper arm area, the back of my forearm, just the whole area, just trying to modulate some of that pain so that it's not so severe. But again, if you start out over this, be very, very careful because again, that nerve is very close to the surface and you don't want to over irritate that. I only spend about 60 seconds to maybe 2 minutes doing that once or twice a day. Also within phase one, you can apply ice or heat, whatever feels best to you. Doesn't really matter to me. I know there's research out there that's supporting one versus the other, etc. And everybody has their opinion on that. So I don't really care. Whatever feels the best to you, do that, and just throughout the day. Phase two is going to begin at around 10 to 14 days. It just depends on whether this was a grade 1 or a grade 2. Remember, if it's a grade 2, I might add another week to week and a half before I start adding in these exercises. Do I keep going with the other exercises? Sometimes I'll have the patient continue with those exercises at home, and then they'll do these when they come into the clinic. But if they have or you have these materials or these supplies at home, then you could just do these and not do the other ones. The first thing we're going to do is going to be wrist extension. So I've got a dumbbell, got my forearm propped up here, and I'm just going to work on pulling my wrist back into extension. Again, you're going to feel this back here on this extensor mass. I'd complete 2 to 3 sets, 10 to 12 repetitions. Then we're going to flip over and go into wrist flexion. So I'm pulling my wrist back, wrist flexion, same thing, 2 to 3 sets, 10 to 12 repetitions. Then we're going to work on radial deviation. So you can kind of see almost like I'm going to hammer a nail here. Pulling back, 2 to 3 sets, 10 to 12 repetitions. Now let's work on supination and pronation. I'm going to grab the dumbbell at the bottom. Now you can initially start just holding the dumbbell regular. So we're going to go supination and pronation and supination. Then as you get stronger and the pain is improving, then you can grab it at the bottom. Keep that controlled. Be careful when you go over this way because it's going to strain the inside of the elbow. Now we're going to use one of these wrist bars here. So I like to take this and go into wrist flexion, and then I'm going to go back into extension. Very similar to what I was doing with a dumbbell. This is just a different resistance, different loading that we're going through. And I usually tell my patients, 2 to 3 sets, 10 to 12 repetitions, and then we're going to take it and bend down like this. Now, when you do this, you want to start light. If this is very heavy with resistance, you're going to really feel this on the inside of the elbow. So you just come down, again, 2 to 3 sets, 10 to 12 repetitions. Now we're going to use these extension bands to the fingers. We're going to go back into extension. You're going to feel this all down the back of the forearm. So we're going to feel this coming all the way back. 2 to 3 sets, 10 to 12 repetitions. And then lastly, we're going to use one of these hand strengthening grippers here. So we're going to squeeze this. How much resistance do I want? Just enough resistance where I really feel this in the flexor mass. I don't want to over irritate this area. So I'm just going to go in here and squeeze this and go for 2 to 3 sets, 10 to 12 repetitions. Now we want to add in some rotator cuff, shoulder, and scapular exercises. So we're going to start with internal rotation. I've got my elbow in here by my side. I'm going to pull the band in. Again, use a light resistance with this because initially this is going to irritate the elbow if you're not careful. Just pulling in and back out, and pulling in and back out. I complete 2 to 3 sets, 10 to 12 repetitions. If it's too painful to make this movement back and forth, you can just hold it statically and step out away from where the band is anchored and step back in. Count that as 1 repetition, 2 repetitions, and so on. Now you're going to perform scapular retraction. So I have the band here fastened over to our power rack, and I'm just going to pull back just like this. 2 to 3 sets, 10 to 12 repetitions. And I may also vary and add in different positions. But again, use some caution. The higher up the elbow comes, the more stress you're probably going to feel on the inside of that elbow where the ligament is. Now we're going to do scapular protraction or chest presses. So I'm just pushing forwards, really stretching out at the end, and come back, push forwards, really push out the end and come back. Use some caution with this. Make sure that you're able to control this. You don't want this jumping around and irritate that ligament. So just make sure you're nice and controlled. And the difference with this versus maybe a bench press or a dumbbell press or even a machine press is when I get out to the end, I really focus on trying to move my shoulder blade around on my ribs, almost like reaching forwards, that extra little reaching bit there, that protraction, really trying to protract the scapula when I come around. And that also creates the need for a lot of stability going through my upper extremity. Now we're going to perform external rotation. So I'm just going to take my elbow right here by my side, I'm going to pull the band out, and I'm just moving with my hand, moving away from my body. So that movement, just like that's what that's going to look like. And that completes somewhere between 10 to 12 reps for 2 to 3 sets. These are bicep curls using a resistance band. Now the difference in the way that I have this set up right now versus how you can do it elsewise is going to be I have the band attached to the bottom of the door, so when I'm pulling you can kind of see the angle here because I'm trying to make sure that I have that good resistance at the top. So I want to be able to go all the way through the movement. Now there's less resistance at the bottom, actually there's no resistance there, but when I come up at the very top I've got a lot of resistance there. So I like to do my bicep curls that way. You can alternate it. You can actually stand on the band and just curl straight up and down like this, or have it attached somewhere low and just curl straight with the elbows just nice and tight tucked into the side. But I just like this. It's at a little bit of an angle going down towards the bottom of the door, and I'm just going to pull back just like this. And I would complete somewhere between 2 to 3 sets, 10 to 12 repetitions. Now something to keep in mind with this is if you keep the hands fully supinated, so palm up all the way, you may get excessive strain and irritation on the inside of the elbow. So what I'll have patients do is kind of angle. So my forearm is a little bit, it's not neutral, it's not all the way supinated, but it's kind of somewhere in the middle and then curled that way. So that my palm is almost coming up towards my chin like that a little bit instead of just being straight on. Going to turn and have a little bit of an angle to that. That'll take some of that pressure off the inside of the elbow. Now we're going to perform ball wall presses. So I'm going to take the ball, put it against the wall, and my elbow is going to remain straight, my shoulder is forwards, and I'm pushing in. So what you need to notice here is I'm not bending my elbow, I've just got my elbow straight and I'm pushing in, kind of oscillating there. And I complete that for 30 to 60 seconds for 2 to 3 sets. Now we're going to perform ball drops and ball tosses. So I have a 2-pound weighted ball. You can use a tennis ball or a baseball or a softball. And so what I'm doing here is just holding the ball out, almost dropping it, and then grabbing it. Just kind of releasing and grabbing, and then ball tosses. You're just tossing it up and catching the ball. Nice and easy. And I complete that for 2 to 3 sets, 10 to 15 repetitions. And that completes phases 1 and 2 for recovery after a UCL sprain. Now again, phases 3 and 4, that's going to be more of your kettlebells, dumbbells, free weights, machines, your skills, all those types of things. So that's a whole separate video, but this is for phase 1, phase 2 of a UCL sprain. Thanks so much for watching.